Hello, my name is Julie Goldhart, and my experiment was about the effect bacteria have on Pseudomonas aeruginosa presented in the lungs. My project was based around cystic fibrosis, also referred to as CF, and that is how I'll be referring it to throughout this presentation. CF is a genetic mutation. There's approximately 1,000 mutations found so far. This mutation occurs when there's an improper folding of the protein CFTR. CF is an autoimmune disease that causes lung and respiratory, which affects the lung respiratory system, pancreas, gastrointestinal tract, sweat glands, and in men can cause infertility. Like I said, this infection affects the lung and respiratory system, and bacterial infections in the respiratory system is what causes most of the deaths among CF patients. A common bacteria found in CF lungs is Pseudomonas aeruginosa, and that is what I based my project around. As you can see in the diagram, right next to it is two airways, a healthy airway and an airway of a cystic fibrosis patient. As you can see in the healthy airway, airflow can go through the lungs easily without any interference. But in the CF airway, there is a thick mucus layer surrounding the walls of the airway, and this causes bacteria to get trapped inside of the mucus. Now, bacteria inside the mucus reproduce and grow because it is a perfect environment for them to grow because it is damp and moist inside of there, and that's what causes a lot of infections and causes a lot of death because they can't properly get rid of the mucus. A part of this disease, the mucus just builds up and they don't have a proper way of getting rid of the mucus. Now, there are no cures for this disease yet. There is a lot of treatments and research going into like gene therapy, such to try to find a cure for this disease and try to fix the improper protein folding. But for now, there's only prescribed treatments to help symptoms, such as antibiotics. And as you can see in the picture of the man, he has a blue vest around his torso. What this vest does is it is connected to a machine, and the machine produces a vibration in the chest, basically shakes the torso of whoever's wearing it to try to break up the mucus layer to help airflow go through and try to break up some of the mucus so bacteria doesn't form in there. So the purpose of my experiment to see how other bacteria presented with Pseudomonas can enhance growth rate in a lung-like environment. The bacteria I used in this experiment was Pseudomonas, Streptococcus pneumonia, Staphylococcus aureus, and Streptococcus pyogenes. I chose these bacteria because in my research I found that these are some of the most common infections presented in CF patients. They might not cause death, but it's a lot of infections that they can pick up. Now, to note with this, how I did my experiment, some of these bacteria grow better in different conditions than other. Pneumonia and Streptococcus pyogenes grow better in blood agar, as I will talk about in the next slide, but keep that in mind that they grow better in blood agar. So my methods for conducting this experiment, I did streaking, which is how you properly spread bacteria onto a petri dish of agar. In the picture I provided, you can see how you appropriately streak a plate, and that is one of the ways I streak some of my plates in my experiment, and I'll show you some pictures later. I also use a spectrophotometer to analyze my data. What a spectrophotometer does, it calculates the amount of light absorbed by bacteria, and how you use a spectrophotometer is you get a cuvette is what actually goes into the spectrophotometer. You fill the cuvette up with the sample, whatever you're sampling, you put it into the spectrophotometer, you close the lid, and you let light go through the sample. And then the sample will read how much light goes through, and that you can understand how much the bacteria has absorbed the light. Like I said before about the blood agar and how pneumonia and Streptococcus pyogenes grow better in blood agar. In this project, I chose to use tryptic soy agar, and I also used a broth. I used tryptic soy broth for my experiment. I found that this was the best agar and broth I could use to kind of hit both the nutritional that the bacteria needed to grow. But you have to also take in consideration that since two of the bacteria I use grow best in blood agar, that this could affect some of my data. The bacteria maybe didn't grow to its potential because of lack of nutrients. Here is for a trial that I did. At the far left, you can see just Pseudomonas, and as I said before in the diagram, that is how I properly streak to play. As you can see, it's distributed all throughout, and you can see the bacteria growing inside of it. And how I grew the bacteria was I incubated all the samples of agar and broth in an incubator at 37 degrees Celsius for 24 hours. That's how I grew every single trial that I did. So that was consistent. The one next to it is Pseudomonas and Streptococcus pyogenes. I streaked the rest of the plates like this so I could see if bacteria kind of navigate towards each other to grow better, or to see if bacteria kind of spread out in their own little colonies. Right next to this, I have Pseudomonas and Staphylococcus aureus, and the last one is Pseudomonas and Streptococcus pneumonia. This is my broth tubes, one trial that I did. As you can see at the top, you can see some of the bacteria clumping together that grew. And this is a good indication to know that some bacteria did grow. Maybe it wasn't to what I wanted. As you can see at the far left, Pseudomonas grew a lot more than what it looks to appear of the other bacteria. So we have Pseudomonas to the far left. Right next to it says Pseudomonas plus Staphylococcus aureus. Then right next to it says Pseudomonas Streptococcus pneumonia. And the last one is Pseudomonas and Streptococcus pyogenes. So here are some of my raw data. I did 8 trials. This data came from the spectrophotometer, from the broth tubes. Now, from the spectrophotometer, since it calculates the light observed from bacteria, the higher the number, that means bacteria did not grow as much, so more light could pass through. In trial 4, one of the first times it showed that bacteria didn't grow was with pneumonia, and it had 1.05. And you can see from the rest trials, trial 5, 6, 7, and 8, some of the numbers were higher too. And we conclude from that the bacteria after trial 5 and so on, the bacteria didn't grow as much as some of the earlier trials. Now there's many reasons why that could happen, but we don't know for sure. But it is good to note that bacteria didn't grow as much as it did in the earlier trials. Here's some more data I collected. So this isn't raw data. So we have mean and standard deviation of all the bacteria through the trials. But what's the most important to take out of this is the t-test I did and the p-values I got. So with the t-test, I did it with Pseudomonas paired with Pseudomonas plus another bacteria. That's how I did my t-test, as you can see in the chart. And from the t-test that I did, I can conclude that my data was not statistically significant because my p-value was greater than 0.05. My lowest p-value I got was with Pseudomonas and pneumonia, and it was 0.705. So clearly that it does not fall in between less than 0.05, and all the rest of the data was greater than that. Like I said, t-test showed that my data was not statistically significant, meaning that my data collection was caused by chance and not by chance. So it was caused by chance because my p-value was not less than 0.05. Some errors that I concluded that could have happened was when I pipetted into the cuvettes, I didn't have enough bacteria into the cuvettes, which could skew my data. Inconsistent temperatures in the incubator. Since my whole class was doing tests, they had to use the incubator too, so the door opening and closing could cause inconsistency with the bacteria growing. Equipment used, the spectrophotometer was the best equipment I could use to analyze my data, and the agar and broth used. As I mentioned before, some of my bacteria grows better with different agar and broth, so that could be a reason for my data coming out as not statistically significant. For future studies, we could base it off my study I did with bacterial enhancement. It's always good to do further studies with different bacteria, and that's what I would do if I did another study like this. I would try to do different bacteria. Future studies also include trying to fix the genetic mutation in gene therapy, which takes a lot of time, and researchers are doing that. Further research on antibiotics and try to get better prescribed antibiotics out to people that have CF so they can control their symptoms better. And testing on something other than agar and broth. For my skill level, this is the best I could do, but with further lab research and lab skills, this experiment, I'm just saying my experiment could be done better than with agar and broth. If I did it again, some things I would change is testing different bacteria with Pseudomonas, as I said in the previous slide, to test the enhancement between them, just to see if my data would come out differently than it did before. Having a different way to test, like I said before, spectrophotometer is what my teacher had provided, and just seeing if there's a different way to test my bacteria to actually see if bacteria together enhances and grows more rapidly. And not streaking on a petri dish. I use a petri dish more as a visual aspect for me to see if bacteria did grow. I didn't take any data from it. I would like to thank my teachers that helped me with this project, Miss Lewis, Miss Baker, and Miss Morrison. They gave me suggestions and helped me throughout the way of my project. I'd also like to thank my mentor, Camila. She was a big help in helping me set up my project and actually do my project. I would also give a big thanks to my parents to help me push through this project and encourage me. And lastly, I want to thank my cousin Parker, who actually suffers from CF, and he was my biggest inspiration for this project. Here are some of my references that I used. And some common questions I might have is there a way to know if I'm a carrier of CF? You can go to the doctors and they can test you for it, so you do know, just in case if your partner and you do want to have a kid but you're both carriers, you can make that decision. Since it is a genetic disease, you can only get it if your parents are carriers and they have a spouse, and there's a fourth chance of you getting this. How many trials are an experiment? There were 8 trials. Each trial I did 4 broths and 4 agar plates, and that was 1 trial. And I did this 8 times for a total of 32 agar plates and 32 broth tubes. Are there any other harmful infections with a person, if a person of CF can get? Yes, there are a lot of harmful infections people with CF can get. They even have to worry about like a common cold. Because their immune system is so weak, they have to worry about colds, infections, anything, because their immune system can't fight it off. I know another bacteria I wanted to use in this project was tuberculosis, but unfortunately I couldn't because it's a biohazard 3, and the lab I used was only up to a biohazard of 2. So any of the bacteria I used had to be biohazard 2 or below it. Thank you for joining my presentation.